Hello, guys, and welcome to another interview series here with the Wittmer Rejuvenation Clinic. Today, I'm very excited to welcome Chassity Wilson. She is one of our nurse practitioners here at the clinic, and we are very excited to get to know her a little bit today and talk a little bit more about not only what she does for the clinic, but some success stories and things like that. So, thank you so much for joining us today, Chassity.
Thank you. Super happy to be here. Thank you, Button.
Yeah. All right. So, to get us started, I'd love to learn just a little bit of kind of how you got started in the industry. So I would love to learn more about what made you become a nurse and ultimately a nurse practitioner.
Well, maybe what made me become a nurse, I think back into my teens, I've always wanted to help people. I've just had a very caring nature. I can remember like taking care of my aunt, like doing dressing changes, when I was 13 years old, just constantly wanting to be there to help people just be their best self.
That's awesome. And then, as far as working with the clinic, what made you ultimately decide to start treating patients with hormone deficiencies?
What made me want to start treating patients with hormone deficiency is basically from personal experience. I ended up at a hormone clinic myself, and it made such a huge impact on my life. I mean, absolutely life changing from, just the way that I interacted with, family members and, my spouse and my children. It really helped out with, my mood and motivation and just energy levels. I just felt like such a better person that I thought, wow, if this is so great for me and, I'm in my late 30s, like this is going to be amazing for my patients who, are struggling with things as they go through the aging process.
Yeah, and our listeners have heard enough about me. I've talked about my personal experience. I'm in my mid 30s, and everything you just touched on is exactly what I dealt with. Was there anything specifically as far as symptoms with you personally that you were kind of really hindering on? I know for me personally, it was definitely my energy levels. I've got a couple kids I run around with, and also just the stamina to keep up with my healthy lifestyle. I just had a hard time there. Did you personally have any of those red flags that you see either in yourself or with some of our patients?
Yeah, I think, as busy as we are, we get bogged down with work life and family life, and it really starts to put a strain on our relationships. So, just helping with hormone optimization, it really helped just like give me that extra bonus to kind of put me over the edge, and, it helped with libido. I mean, that's huge, right? In a
Yeah.
relationship, we all experience, some decreased strain in marriage when we're trying to just perform, right? Um, so that was really amazing. And what's great for me with especially my female patients when they come back and they say, I have a sex drive. Like I never knew I had a sex drive. Like that's great.
Yeah.
I love to be able to put that power in a female's hands that they feel good enough that they want to, be with their person.
Yeah, and that's awesome. You always think about with males how it affects their libido, but I think the bonuses of what it does for the female community is great as well. And that's actually the next question I would like to ask you is, what are some of the importance you see specifically with the female community as far as getting their blood work done and then ultimately getting hormone potentially starting hormone treatments?
Well, depending on age, of course, as we start going through menopause, there's things that we need to think about that happen, with estrogen deficiencies. So, bone loss and those kind of things. Libido, of course, can definitely be impacted when women are going through perimenopause or menopausal stages. But I mean, there's also women who experience like low libido early on, as early as their 30s. And sometimes hormone optimization can help with that. So, and then, thinking about thyroid, of course, if somebody's struggling with a low metabolism, sometimes optimizing thyroid would be beneficial as well.
Yeah, that's great. And I think that we've kind of turned the page a little bit, especially specifically at our clinic, where we are starting to bring in more female clinics, and I think the education on that side is starting to grow, which is great, and it's also why we're doing questions like this, where we get to talk to a professional a little more about it. If you were to sit down with maybe one of your close friends or a family member who is a female, and maybe they had some feelings, or maybe they were a little nervous as far as potentially getting started with this process. What are some things that you would maybe mention to them? I don't want to say to persuade them, but to get them to understand the importance of potentially getting their blood work done and moving forward.
Um, I guess, that, we're trying to very closely copy or mimic what the body is already naturally making, right? So, we're not trying to, push things extreme by any means, but just to improve quality of life. Things are monitored. We're repeating labs regularly to, make sure that everything is safe and appropriate, and talking with our patients to check up on any side effects that they might be having as well.
I think that's awesome. I think that's what I always lean on when I have conversations with people close in my circle is just the ability to optimize your life and to get the most out of your relationships and your lifestyle and all your different things there. I think that's what's been most important to me moving forward as well. So that's really cool. Another area you help some of our patients with is weight loss, and specifically medications like Tirzepatide and Semaglutide and things like that. To get started, let's talk a little bit about what are those medications, specifically Tirzepatide and Semaglutide.
Yeah, so these are medications that affect incretin hormones in the stomach. They work really well. There's a few select patients that really shouldn't be taking these medications, so super important to get a health history whenever you're going through this process and thinking you might try this. Um, I typically will say, if your goal is to lose over 20-25 pounds, tirzepatide or semaglutide would be appropriate for you if you meet that criteria. Um, you know, they work really well, and they can some people work very, very fast, and so making sure that you're combining these types of medications with a healthy lifestyle. Your diet's got to be on point, you've got to be exercising. You can't really just be sitting on the couch and taking tirzepatide and expecting, not only you'll lose weight probably, but you're not going to maintain that weight if you're not living a healthy lifestyle.
Yeah, for sure. And I think that's what I love about our clinic is that we do practice both of those things where it's also the healthy lifestyle, but then also potentially some medications that can aid in that as well. So you did mention who this is specifically for, but I'd like to dive a little bit more into that because tirzepatide, semaglutide, things like that, they're not for somebody who wants to lose, say, maybe 5 or 10 pounds or, just kind of wants to tighten up a little bit. This is a little bit more for the obese community. Is that correct?
Yes, absolutely. Yeah. I think, in the way that I tend to look at this is, if people are just looking at 5 or 10 pounds, then we really need to take a closer look as to what we can do to optimize your hormones to get you there. And in a lot of patients, we're optimizing hormones and starting them on tirzepatide or semaglutide, depending on, their specific scenario. But I always would fall back on let's optimize you first and foremost. Let's get you to your best version of yourself and add the medications if we need it.
I love that answer. That was a great answer. Thank you. Do you have any specific stories or use cases you can think of with maybe one of our patients that you'd like to maybe highlight a little bit as far as somebody that we potentially went this route with them and it was life changing for them?
Yeah, yeah, absolutely. So, and I know this woman personally.
Oh,
She lives
great.
close to me, and she got started with us back around February timeframe. She had never been on any kind of hormone optimization. She had never tried tirzepatide or semaglutide. But we started off with thyroid, testosterone, I believe progesterone, and then we added in semaglutide, and she has lost 70 pounds. She looks amazing. Like I see her Facebook posts all the time, and her husband are just having a great time. He's now a patient because he's seen such great turnaround in her, and they feel really good, and they're very happy, and she looks great.
Oh, that's awesome. That makes me smile for sure. I love hearing that stuff. I got two more questions for you, but one of them popped into my head here is as you were talking about the relationship between a husband and a wife. A lot of times we get one and then usually the second one follows and things like that. So, as a nurse practitioner, we talked a little bit about all the benefits that both of us have seen, people in our circle, people you've treated, all that. What do you believe, or let's word it this way. What do you think is important when it comes to having those conversations with a partner? So for instance, I know with me and my wife she's known me for a long time and she was like, hey, something's not going right here. And I know that could be kind of a hard conversation, not only for the person receiving it, but the person also trying to have it. And so with your professional background, what are some suggestions maybe you have as far as that relationship side, since you've been able to deal with that as well?
So that's one of my favorite things is getting that like husband and wife couple because there's some very interesting conversations that we get to have. Just as each of them being my own patient, so that's super fun. But I think we have to match each other's energy, and that's usually why the other person ends up over. Like my husband feels so great. His energy is up, his motivation's there. He's going to the gym. He's trying to make me eat healthy. Like I'm just not there, and the sex drive is there for him. And so then the wife comes in and we get her sorted and she feels so much better. So I think that just being honest with our partner and letting them know what we're doing as far as hormone optimization is the main thing. Like start that conversation first and foremost. And then I think it's great to have both parties on board with hormone optimization.
Yeah. And the libido is always a great bonus for both of them as well. And as you mature into your relationship and your marriage, having that fire all the time is something that's really exciting. I know for me personally. So thank you for sharing that as well. Yeah. All right. Last question I'd like to ask you is just what's the most rewarding part of your job? You've been working with us for a little while now, and we love just hearing a little more about what gets you going as far as your job and how awesome it is you get to work with all these patients.
The most rewarding thing for me, I think, is like the follow up calls. Just checking in on people after we get labs done. It's that 6 week, 3 month, 6 month interval, and people are telling me things like my joint pain is gone. These menopausal symptoms, I'm not hot flashing anymore, or my mood is up and I feel really good and I feel like I'm communicating better, or maybe just getting along better with whether it's the spouse or the daughter or the coworkers. So just the improvement in relationships, so just getting that feedback, like I know it's going to come, I know that most people do really well. And it's just, so it's very rewarding for me to know that I'm helping people. And it makes such a huge impact in their life.
Yeah. And as a patient, it's really cool to kind of have somebody like you in our corner where we can have those conversations of, hey, these are all the things I'm dealing with. These are all the kind of the issues I'm having. And then, you get your blood work and you guys do a great job of, in that first call of, okay, here's the first thing we're going to talk about. And you guys really walk through every individual part and explain to the patient from an understanding of like, okay, these are the things that are going on. This is how we're going to fix it. And then, as you mentioned, 6 months later, a year later now for me to see the improvements, not only in just how I feel or how I look, but also I'm a data guy. So I love being able to look at the data and seeing the improvements and things like my resting heart rate and my cholesterol levels and all that stuff. So I think that there's just so many added benefits to what you guys do for us. And I just want to extend my appreciation for you and everything you do for us. And I can tell in this quick little conversation how much you do care about what you do, and it's really awesome to hear more about it. And so we really appreciate you taking some time to chat with us today, and we're going to let you go. We'll bring you on again next time we have some more topics to dive into, but thanks again for your time today, Chassity.
All right. Thank you so much, Brent. I enjoyed it.
All right. Thank you.